My name is Victoria Smith. I attend Howard University, and this presentation is on the effect that music has on our mood. Music may seem like a minuscule part of our everyday lives, but listening to music can have an amazing effect on our mood. Currently, the nation is averaging about 129 suicides per day, according to suicide statistics, and most of these suicides involve some sort of depression. Although just listening to music isn't the only answer to decreasing these suicide rates, research has shown that musical therapy does yield results. Many benefits of listening to music include an increase in memory, a reduction in pain, and a decrease in stress amounts. Listening to music can also be used to control our state of being, attain introspection, and it can be used as a source of comfort. More lighthearted music is beneficial for learning new course material, and music that is more mellow and calm is beneficial for studying. And music has also been proven to better mood abnormalities. When applying musical therapy to patients, this much research has been conducted in order to test how effective musical therapy is. Using lyric analysis to assist patients in dealing with their thoughts and emotions has been researched upon, and certain treatments applied in musical therapy have been used in order to aid patients with acquired brain injury to combat depression and regain former lost abilities. And at the Beth Israel Deaconess Medical Center, stroke victims with issues involving speech seem to profit from singing song lyrics. Musical therapy also has an effect on blood pressure, breathing rates, and pulse rates. And a previously conducted study noted in the Modern Care Journal showed that musical therapy was effective in reducing depression. The research question in my study is, will consistent musical intake yield results of a positive state of mental health? My hypothesis is consistently listening to the music of your choice will reflect a positive mental state. The independent variable is the amount of musical intake, and the dependent variable is the mood or the mental state of the participants. This design will be an ABA design that includes some narrative research. Within this type of study, the treatment will be the removal of that consistent intake of music, and the responses of the participants will be recorded through their narration of this experience. When it comes to participants, I'm looking for college-age students of any gender. I just chose any school, for example, Howard University. Participants at Howard University will be randomly selected through a computerized random selection program, and 4 participants will be the minimum because I'm looking for at least one student from every grade level in college. Variables include age, which will be from ages 18 to 23, and sex, male or female. An overview of the research will be given to all prospective participants prior to research being conducted, and written consent will be obtained from all who would like to be involved with this research study. This study will last for a period of 2 weeks, and within these weeks, the participants will need to meet with the researchers 3 times in order to take surveys and discuss their emotions. The baseline is the participant regularly listening to music at least 10 minutes per day, and the treatment will be the participant not listening to any music or any songs of their choice. In the first meeting with the researchers, participants will take a survey that asks generalized questions on mood, emotions, and mental states. In the second meeting, after music has been removed for 1 week, participants will take that same survey. In the last meeting, where music will be reintroduced to the patients, or to the participants rather, they will take the survey one last time and will also speak to researchers on their overall experience. For my data analysis, Content of each survey will be analyzed after each meeting time, and this content will be categorized into various themes, including positive versus negative emotions, an increase or decrease in anxiety and depression, an increase or decrease in stress, etc. After all three of the surveys have been obtained from each participant, comparison in the themes present in each response will be made. A count will be made of how much each theme is present in these surveys, and in the narrative reflection, and these counts will be converted into percentages.